Here's the display of the armamentaria, the 30 gauge needle, anesthetic of choice, topical gel, the wand for the Numblebee, and the sterile tip enclosed in the single wrap package. And if you'll notice, these come single packaged for a reason. They're used one time, so the tip is removed from the pack and gently placed onto the wand. It doesn't have to be pressed real hard, because if you press it on too hard, you risk breaking the tip and the seal. So as we open up our syringe pack, syringe obviously has just come out of sterilization. This is a standard dental medical syringe. The anesthetic carpule is loaded, and you notice this is a self-aspirating style syringe. Carefully screw on the needle of choice, and it doesn't have to be a 30 gauge needle. It could be a 27, a 24, a 31, a long, short, but this is your typical assembly. I am now opening up the topical gel cream. This is optional with the palatal tip, and if you notice, the contra angle where the disposable tip bends, the bent side is what's actually going to contact the palatal tissue surface. The topical anesthetic is applied on the tissue surface because we are going to be applying that against the gum tissue on the palate. And our needle's capper is removed. And I want you to notice how the tip is designed to receive the needle in a funnel shape so that the needle doesn't bind on the edges. If you're putting it in from the wrong side, you'll notice some binding, and it kind of forces you to use it the proper way. So the motor is turned on, and when the motor's turned on, obviously the light comes on. Just anatomically speaking, just so we kind of have our ergonomics and our landmarks clarified, the greater palatine foramen exits about 1 centimeter outside or palatal to the gingival margin of the second molar, typically in adults. And watching the video, you notice that I'm pressing the contra-angled surface and bending the needle at about a 45-degree angle. What this is allowing the operator to do is get a straight approach through the disposable Numblebee tip, the palatal tip, and if you notice, once the needle is inserted, it goes right to the area of choice. Now, whether this is a greater palatine or an incisal or just infiltration above a particular area or the pillar area, it pretty much gets used the same way. In the mouth, we're going to talk about the only very important process is that the blue tip must be held firmly, and I can't stress that enough, firmly against the palatal tight tissue, because remember, we want to fire the afferent to the brain to maximize the effectiveness of the ouchless properties of the disposable tip and the vibrating wand. So all three neural concepts come together if they're all applied at the same time. Going to the mouth with our live patient demonstration, again, the disposable tip is inserted, press fit onto the wand gently. Again, I can't emphasize that too much. Our needle is bent at about a 45-degree angle, and the reason for this being bent at the hub, there's no chance of breakage because obviously the needle will not be inserted completely into the tissue. The periosteum will take care of ensuring that we never put ourselves in that position. With the patient opened and in the supine, slightly supine position, I would recommend if their upper arch is at or perpendicular to the floor, that's plenty. We really don't need to stick them back on their head. But if you notice, I'm getting a finger rest on the tip of the wand with my middle two fingers, holding the wand in my hand of choice. I'm left-handed, so what you'll see here is I'm holding the wand with my right hand, holding the needle with the bent side, going toward the tip. But if you notice, the bend has to be slightly pressure bent against the palate. If the neck of the disposable tip is not bent, you're probably not going to get as good a result. You'll get a good result, but it won't be a perfect injection. If the wand is held properly against the tissue, it will leave a ring-like depression in the palatal tissue. And again, we can't overemphasize placement. You want that tip intimately in contact. After the palatal injection is given, the disposable wand is disposed of in a biohazard container, and we're finished. Patient's happy, doctor's happy, practice is happy.